Hey folks, so Dr. Kuniak with a supplemental video lecture. One of the things that I wanted to talk about today is related to the assessment process. So we're going to talk about intake in our next live meeting, but I think something to consider is students and supervisees, for that matter, new into the field, get wrapped up with this idea that in order to do good assessment, you have to have some sort of a tool. There has to be some sort of a written, printed assessment tool out there that you're utilizing. And one of the things that we forget about is we forget that we ourselves are kind of the tool for this process. And so even though it's a little bit subjective, sometimes it's important to note the things that you're observing. There is a Gestalt counseling principle that talks about the figure and the ground. And so what it's referencing with figure and ground is it's talking about if you imagine an image, so like my image on the screen here, I am the figure for you, I'm more forward, and the ground is this whole backdrop. So in a counseling session, it's kind of the same thing. We become very focused on things like, the time, which we have to be, and so I recommend putting stuff like that like in your view so that you don't have to be looking at a clock or checking your phone or things like that to know your time. It sounds simple, but it's, an office that I used to work in had clocks all over the office in different places so that the counselor's eyes could catch it, catch a clock in one place or another. But so to my point, the thing is, we get so focused on all of these other things that are going on, we forget to pay attention to what's happening in the moment. And so one of the things that I want to kind of impress upon you in this discussion is the idea that you are an assessor. You are an assessing instrument too. So when you're talking to the client and they're saying one thing, but their facial expression is conveying something else, you should note that. That's the sort of thing that goes in the assessment section of the note. I know I talked about that with the DAP note in our first meeting, data assessment plan, and I said that I want you to talk about your clinical impressions in the assessment section. So if you bring up the client's, partner, that often comes up in these discussions. You bring up the client's partner, and they want to talk about these relationship issues that are going on, and so you bring that up, and a facial expression changes, or they can't make good eye contact with you, which I recognize we're in video, but still, if they're looking all around but they're not looking at you, if they start to fidget, if they change position, those are things to note. With it, you have to ask yourself, why would they be doing that? And so that's where we're allowed to kind of make some assumptions based on what we think is actually happening, what those movements mean to us. So a lot of times in notes, whether with a student or a supervisee, and I apologize, my email just dinged. I don't know if you heard that or not, but I encourage students to just tell me what this means. Tell me what this thing, you wanted to do I can remember having a supervisee who talked to the clients every week about doing a family sculpting activity, but they never did it. They kept talking about it, and then they would just, somehow it wouldn't play out. So one of the things that I talked to them about in supervision was stop recommending doing sculpting and just do it. Do it during a session. The client's never going to agree to, I want to try this activity, and let me explain it all out to you, and it was created by so-and-so during whatever period and everything. Are you okay with that? They don't really know. Like, you can explain it to them beautifully, but they may not want to do it. So just say, I wanted to try something with you today. Let's do this, and just go through it. I had another supervisee who brought that up with the miracle question in solution-focused brief therapy. Every week it was, I'd like to do a miracle question with you. I don't want to do that now. Okay. And then they would move on. The other thing is, I would want to know why. What does it mean that they're avoiding the discussion about the miracle question? You may not know, and that's okay. Kind of like we were saying in the first session, you have to apply a diagnosis, but you may not really know what diagnosis they are yet. That's fine. Educated guess. You've gotten this far in the program. You've shown skill in being able to understand the material and understand human behavior. Now it's important to try to figure out what these behaviors mean, because I think it's easy to think that every session we come in, the client's going to bring the information that we need, and that's simply not true. Clients don't know what they need to bring us. Every session is sort of new and mysterious. They may not want to talk about what's really relevant. They may lie to you. And these things are all important to kind of keep in mind. And so as a result, you as the counselor are responsible for driving some of this, driving the session forward. And just because a client says, no, I don't want to talk about this thing, doesn't mean it's not relevant anymore. It may mean that you need to approach it a different way. A lot of times individuals will avoid a conversation because that is what's most relevant. Think about, the idea of resistance is that the client puts up resistance and prevents us from moving forward with the work that we intend to do. Resistance is frustrating because we're not able to do the next thing, but resistance is kind of a natural phenomenon. You're poking at painful, uncomfortable areas of their psyche, and so they resist. That's a healthy reaction. It's frustrating, but it is a healthy reaction. So I want you to consider what all of these behaviors mean. What might they be protecting themselves against? One of the things that I do to try to accomplish that is I ask myself why I might do that. Now, not every person is me, and not every person is going to behave the way that I behave. And so sometimes I'm completely off when I guess this, but it gives me a start. So, if a client is really upset because I brought up relationships again, their partner, even though that's something we've talked about in the past, I have to ask myself why I would be frustrated with that, why I might be defensive about that. Maybe something happened recently. Maybe I'm really pushing on something. Like I can remember in my own past, times when I was in a relationship and my friends asked me how things are going and they weren't going very well. I really didn't want to talk about it. So maybe that's why. Maybe it's not. Maybe that's completely wrong, but it at least gives me a starting point. And so it's important to kind of note some of those clinical impressions, because as you think about the why, then you can help yourself to figure out what the next course of action might be. So they're really sensitive around this topic. Okay, well, maybe I don't talk about it directly, but maybe I find another way to approach this. I find that, pushing up against resistance, even in that assessment process early on with my clients, isn't really helpful. They're going to resist back and push back. I know that this is important now. I need to find a way around it in the conversation. And so talking around and asking questions around is helpful. The other thing I want to get you thinking about, and I'm not going to take a whole lot of time to talk about this, I'm going to save it for our next conversation, but the other thing that I want to talk about is finding a theme that's present in your sessions. You're not going to find it on the first session. I know we talked about guessing a diagnosis based on your best educated guess for your first session. That's one thing. We're talking about what something means and taking an educated guess at that. That is fine. You can do both of those in your first session. In your first and second session, I want you to note things that you start seeing popping up. You want to see if there is a common underlying emotion or thought pattern that is exposing itself through these similar things. I can think of a particular client where, they're talking about their relationship with their mom, their relationship with their estranged and sort of out of the picture father, their significant other, and, their boss, and some other stuff. These may all seem like very, disparate, unconnected pieces to the whole picture. But over time, I came to realize that the same thing that they're talking about in all of these is these relationships are ones where the other individual has all this power, and my client is starting to express this theme of unworthiness, that the father is not in the picture because they don't deserve the care of a father. Their mother doesn't give them the care that they feel like they need because she's wrapped up with her own struggles. Their boss is only interested in the business the company needs, etc., and their relationship, their partner seems to kind of take advantage of them. So in all of these different themes, or in all of these different situations, the theme of unworthiness sort of came up. So I want you to start paying attention to those things. The theme may not become present on the first or even second session. You can start to note these themes, though, and that will help you to get from surface level conversation, what we consider first order change. So when the client says, I'm late all the time to work, a first order change might be teaching them how to set their alarm clock or something like that. That's fine. That'll solve a problem, but it's not really getting to the crux of it. Figuring out that, well, they're late in the morning because they stay up all night, because they're exhausted, because they don't feel like they're fulfilled during their day, and so they're, spending all night trying to kind of replenish their energies and everything like that, and that makes them sleep in later in the day. And so we want to talk about what fulfills them. That's second order change. That's getting underneath the surface, but you're only going to find that if you start to note the themes that are going on in the counseling process. So I want you to consider what is popping up. And so this all comes down to early assessment. Little things you note. I bring this thing up and they kind of react this way. I talk about this and they seem to lighten. And so that might be an interesting topic to explore, because we don't always need to go to what's bad. We can talk about what's working well. But we need to kind of figure out why we're doing these things and what the purpose is and where we're going. So hopefully that's a good initial conversation to have and a good initial video lecture. I want to talk more about the observations and the, discovering themes and stuff as we go along, because that's going to be a continual conversation. But I think that that's a good start. Hopefully you agree. Let me know if you have any questions, comments, concerns. I'll see you in a live meeting coming up, but certainly in between, let me know if anything's on your mind. Look forward to talking with you.